Before treating an anterior knee pain, you should figure out if it's patellar tendinopathy or patellofemoral pain. There are a lot of distinguishing features. The one we're going to talk about today is landing mechanics between the groups. Here is a clip from my podcast with Jill Cook.
Find when you hop people with patellar tendon is they'll land very stiffly. They do not want to bend their knee because they know it's going to hurt. But when they do land, they often have relatively good hip mechanics in that they don't tend to get the pelvic drop on that side and the internal rotation of the femur. Somebody with patellofemoral pain hops very differently. They often will bend their knee. Their pain will be in 40 or 50 degrees of knee flexion, whereas people with patellar tendinopathy have pain very early in range, and so they don't bend their knee. But you'll often see their hip rotate internally. You'll see lumbopelvic control, and so there's quite a distinct difference in how these people use their kinetic chain.
So if someone presents with anterior knee pain and they look like this when they're landing, you should think patellofemoral pain. If they're landing like this with the knees coming in, more valgus position, a lot of knee flexion, you should think patellofemoral pain. So what do we do to fix this? Usually we go to something like landing mechanic drills, like a snap down, keep the knees out. This is a very low stress, closed environment. We should question whether that's actually going to work. We should look at the hips. Girls usually get patellofemoral pain. They got wider hips, their knees come in. This causes internal rotation on the femur, external rotation on the tibia, and we need to control these forces. The best way to do it is probably general strength training. Something like split squats, something like squats. Strengthen the muscles around the hips so that they can help when you're getting in those weird landing positions. So what about people with patellar tendinopathy? They don't have the same issues with valgus collapse. They don't have the same issues with weakness at the hip. They just don't want to bend their knee when they land. They have a very stiff landing strategy. This actually causes more stress on the patellar tendon. In this study, jumper's knee or lander's knee, they saw that a short landing time is associated with the onset of patellar tendinopathy. When athletes only land stiffly, they're more likely to develop patellar tendinopathy. In this study, they saw that the patellar tendinopathy group, the people who actually had it, had a more acute lower extremity contact angle. This is causing more stress on the patellar tendon because the smaller angle means a higher braking impulse. The patellar tendon has a lot more force that it has to absorb. It has to work very hard. So in this study, they looked at the drop jump. People with patellar tendinopathy had less knee flexion angles than the controls. So what can we do with all of this advice? We should look at the four-stage process. If you're taking someone back from a patellar tendinopathy, the isometric phase, the isotonic phase, but when you get to the energy storage and release, when you're getting back to jumping activities, make sure that the patellar tendinopathy athletes can land with a knee bend. Make sure they're not always landing with straight legs. The straight leg landings are more stressful on the patellar tendon. Make sure from time to time, or maybe with the majority of the controlled weight room jumps, that they're landing with a knee bend. A box jump can be a great exercise, a high box jump. You look at this, you get higher and higher. The knee flexion angle gets higher and higher as well, and you can slowly accustom to it because gravity is less of an impact. Something like a hurdle hop is the opposite. There's not much knee flexion, but this could be good to train knee flexion landings and low knee flexion landings. They both can be useful. So when athletes are getting back to sport, they can land stiff like that, or they can land in more of a knee flexion position like that to distribute the patellar tendon forces. So hopefully that helps. Try it out. Enjoy.